I'm with Howard Quayle, and continuing, I looked through this pamphlet, this document. Residential care is one that really hits a lot of people's nerves, obviously, because at some point everyone thinks, I'm going to be shoved in some home or whatever. You're saying approximately half of those in residential care are self-funding now. Yeah. Self-funding meaning they're paying for their care, they're paying for their board, bed, what?
Yeah, they're paying for their care. However, about 51% is paid for by the government, and that costs the taxpayer about £20 million a year, Paul. So if we can devise a strategy where we can enable people to live at home longer or in the community by building more sheltered housing, that has to be a win-win. It's back to my win-win situations. If you can live in the community safely and not have to go into nursing homes, it's better for you because you're living with your family. But 20 million, 51% that the taxpayer has to pay for, it's financially beneficial. So if we can design apartments, and there's going to be announcements that Westlands are building a new development of apartments where there's no steps, there's showers instead of baths, there's the plug sockets are slightly raised, the light switches are slightly lower. It's enabling people to live amongst their own community for much longer. Then that's going to save the taxpayer a considerable amount of money and improve the quality of life for our elderly population.
But I mean, it's more political than anything. The fact is that people who save money and got their own houses are then asked to pay for their care, and people who haven't saved money and have lived in just rented accommodation, whatever, get it anyway.
Well, and that's personally, that's one of my pet topics. I had a company where I had about 20 people working for me, and some of them had their own mortgages and lived responsibly, and some were out, down the pub, holidays every 5 minutes, and never had any money, and I had to pay them fortnightly instead of monthly. Now, it struck me one day that if you fast forward, and let's say we all hit 80 and we all went down with senile dementia, which is a very expensive form to look after, on the same day, my family and the responsible ones who'd saved hard, paid a mortgage, would pay for it. But in the room next door would be the other members of staff who didn't have a penny, and the taxpayer was paying for everything. Now, personally, I've looked at various schemes to see how can we avoid that. And Guernsey went down this route, where they set up a policy which is effectively called, stop my house being taken off me by the government. And unfortunately, they didn't put enough aside, and the fund is running out.
But the UK have made a big thing about saying it shouldn't be this sort of paying for your own
care. It shouldn't be. But
you don't see a way of following that?
Well, there's a £20 million shortfall that's got to be, Paul, that's got to be plugged.
Again, we can come back to some silly things. All nursing home care in the islands is provided by the private sector.
Yeah.
And it says there's no nursing homes in the island which can provide care that's affordable at benefit level. So
at the moment,
so no one that is on benefits can get into residential nursing.
No, it means that the income that we pay towards it is less than the cost that's currently being provided. However, maybe giving you a scoop, Paul, is that we are looking at building a new facility. We will be putting plans to Tynwald in the hopefully not too distant future for a new residential nursing home set up at Glenside.
Oh, right.
But this is
on the Glenside side.
On the Glenside, a 60-bed unit, but that it's years.
Yeah, but you're going to keep that site. That is interesting, because I assumed it was going to go. Well, a lot of people assume it might be anything else, but
no, it's I've put it aside for a nursing home and also sheltered housing. That's our long-term.
So that's in the pipeline.
That's in the pipeline. As I say, it could be 2018-19 before it's actually developed, but those are the plans. So we're trying to put the facilities in place. We're trying to practice what we preach here.
So that's in your pink book sort of estimates, or whatever in the future. I mean,
it's going to. You're
going to get that money off government.
We're working on this at the moment.
Okay. Yeah. Well, I mean, pretty well there. We've. One of these things that you're looking for consultation, are you, from the public?
Yeah, well, we're going out for consultation, but we're also going to have visits, because this is a massive topic, Paul. We've got to have a conversation with the public. We have our ideas, but we want what do the public want? And then once we've been out for consultation and listened to the public, we've then got to go away and come back with detailed schemes on about how it's actually going to work. We've put forward a framework about where we, trying to show the problems that we're experiencing, what we think has got to be done. But this is, as I said at the start of another interview, Paul, with you, this isn't my health service. This is the Isle of Man's health service, and everyone has to have a buy into it, and a realisation about what they should get from the health service, and what should we fund and what shouldn't we fund.
Surprised you call them people, because I thought you called them customers.
Customers, yeah.
I mean, I was a bit taken back that someone who's written this has decided they're not patients. The word customers, because we want to foster the principles of customer service, the people who care for what's traditionally known as patients. I mean, that is a bit, customers, really?
We are offering, the Department of Health and Social Care and Nobles is offering a service to people. So if you go, a service, you're a customer. I suppose you could argue it's immaterial. At the end of the day, you're an individual, and we want to give you the best service we can.
And let me put it to you: would you put your trust? Do you have private cover, or would you be NHS? Do you have that yourself? The trust
I have no private cover.
So you have trust in the facility. If to, heaven forbid, next 2 days something happened to you,
yeah,
you would have faith in the system.
I'm in Nobles in the NHS, but as the health minister, I am constantly, trying my very best with a big team of people to improve the service that we deliver for the people of the Isle of Man.